Hello everyone, myself Dr. Udit Saxena. Today we are going to present second episode of Consultant Podcast on our Asha Kai Chikitsa. Today we are going to meet Dr. Abirami. In her introduction, all I can say is she is one of the sharpest brain of Ayurveda which I have ever seen. She has completed her MD in Panchakarma subject. Her research work program has been selected in PG Star program by CCRAS. Let's meet her. Welcome. Hello, Dr. Abirami. Welcome to our podcast.
Hello, Dr. Udit Saxena. Thank you for inviting in this podcast channel.
So, Dr. Abirami ji, tell us about your journey, about yourself, how you have ended up here.
Yes, doctor. Myself, Dr. Abirami. I was born and bred up in Pondicherry, which is a place where yoga is being a part of my life since my childhood, because both of my parents are dedicated many years in teaching yoga practices. So since childhood, I have some kind of familiarities with its principle and its techniques. So after my graduation, I was eager to do my career in this medical field. Consequently, I have taken BMS degree in my UG at Rajiv Gandhi Ayurveda Medical College, Mahe. During my internship program, I have been well trained not only near the college campus, that is in Kerala region, but also I have been well trained under Dr. Batma Thamma and Dr. Jeevanand sir in rural postings of Pondicherry. After my internship, I have been practicing Vastis and various other Basti Karma under the supervision of Dr. Jeevanand sir in his clinic. Thereby, I got that much interest in practicing Panchakarma, which paved the way for me to pursue this MD specialization in Panchakarma. And presently, right now, I'm doing my final year in Sri Jendra Saraswati Ayurveda Medical College, Chennai. And I believe that this Ayurveda and my background, like yoga, could completely merge and we can give much outcomes in this current era. Thank you.
So, doctor, as you have done your research in Basti, so what is Basti and what is the importance of Basti in Ayurveda?
Yes, doctor. Panchakarma holds the heart of the treatment of Ayurveda, where Basti, being one of the Panchakarma, holds its superiority, and we can term it as like Ardha Chikitsa, where all the three Roga Marga diseases can be given good outcomes by Basti, and it is also can be given from childhood, like from children to old people, by modulating the dosage and the yogas in it, and it will give quick effect, Shigra Falakari, like that it has been told. So it will give quick effect and we can modulate which action we need. Like if we need Utklesha Karma, we can use Dosha Utkleshana Basti, and if you need Shamana, if we need Shodhana, it can also work like Rasayana, Vajikarna, Lekana, Brahmana, like whenever which karma we need for that avastha and for that particular patient, we can modulate the Bastis. Like this much various pathways can be used for Basti and holding a great importance in Panchakarma.
Okay, doctor. So my question is, we are not going deep into the types of the Basti. What are the common mistakes, as you have told, it's Ardha Chikitsa in Ayurveda. So what are the common mistakes you find in your practice, in your daily you have seen?
Yes, doctor. And since Basti has been practicing very commonly, and there are many misinterpretations or there are some common mistakes which we are doing without knowing it. So I want to address it more so we can practice it without mistakes, so we can get more effect in this. So we can get it into these two ways. Like one is in the preparation of Basti. So where each step of preparation, like we are particularly focusing in Nirohasti, where each step of preparation holds its own significance of forming an homologous mixture. So each step has been taking around 25 minutes to 30 minutes for churning it up. That we are not doing much. Like as we are having very less time, more patients, we are completely finishing within 5 to 10 minutes the whole process itself. So, like for finishing a whole process, we need at least 1 hour to prepare the basti. Because why this time and churning gives its own importance? Because after being a homologous mixture, we can see like a research has been done where the particles has been reduced to around 10 nanometer size, like that been less than 0.10 micrometer, so that action interaction or its bioavailability in the intestine will be more, so the effect will be getting more. So that much particle size has been reduced by churning around 1 hour of bastis. That gives importance in the preparation. And in the procedure, prior abhyangam and swedanam is given much importance because when for increased absorption and increased effect, prior abhyangam and swedanam, and giving it ardrapani of anuvasana vastis. And coming to the mistakes during procedure, what I felt is like a maximum number of times we are not doing prior abhyangam and swedanam for specifically to anuvasana vasti or sneha vasti or even matra vasti. Like we are giving at any time after they are eating. But what I feel is like if we follow prior abhyangam and swedanam as a purva karma before any vastis, that will give us a desired effect of what we need, that too in particular a less reduced time.
So, doctor, as you have told, the Purva Karma is mandatory in that. So, my question is it mandatory to do Shodhana in that also?
Yes. As being the order of Panchakarma, even for a Swastha or a Rogi, there is a verse like Basti should be followed after a Shodhanam, like Vamanam or Virichanam, but it's not mandatory in all the conditions. If it is a Kevala Vata Rogas or prolonged chronic Vata Rogas, there we can give Vastis, like especially Anuvasana Vastis, for a period of time without doing Shodhana also. It's has been quoted in Sushruta Samhita. And also, this Shodhana also has its own role. By eliminating all the malas and clearing the srotas, like srota Shodhanam, then if we are giving Basti Dravya, it will be more, like more absorption takes place and it will be giving more desired effect. So according to the condition, Shodhana is necessary or not, the practitioners, because like by their yukti, like according to the condition, whether Shodhana is mandatory or not, the practitioners yukti, they have to decide and they have to fix the schedule.
So, doctor, usually what we see that Anuvasana and Niru Basti given the alternative day in Yoga Basti. So, have you ever seen or practiced that they can be given on the same day, Anuvasana and Niru both?
Yes, doctor. This practice has been there, like giving morning Nirvasti and afternoon Anuvasana Vasti can be practiced in my college under Dr. Praveen's guidance. I have first time seen this practice. Usually, I have never noticed this morning Nirvasti and afternoon Anuvasana Vasti. I have never seen, like in the alternate days only in my UG have exposed. But here, when sir has been practiced, have been knowing that okay, morning we can give Niruvasti and afternoon we can give followed by Anuvasana, thereby reducing the total schedule time, which is very easy and convenient for this today's present era, because right now everyone are stipulating with their own time, so they are not giving us much time to finish our Panchakarma texts. In this current era, this practice of giving Niruvasti in morning and Anuvasana in evening is very convenient. So this is also quoted in Sushruta Samhita, where Niruvasti in morning and Anuvasana Vasti in the afternoon. That is exactly after it. Like if you are giving planning Niruvasti at 11 or something, 11 a.m. So after all the elimination of feces, malas, everything, then we are giving Bhojana, right? After Bhojana, immediately that Adrapani, we are giving Anuvasana Vasti. So if at all we are planning the next day, like this day Niruha Vasti and followed by Sneha Vasti can be practiced. And also in certain conditions where we are having bhaya of Vata Kopa, like by giving Niruha Vasti, because of its ruksha guna, like we are fearing like vata kopa is happening, that condition, that state, we can practice that day itself like anuvasana vasti. Like it's according to the yukti and the avastha of the patient only. We are deciding that day itself we are doing, or it's okay, fine, like we can give not that much vata kopa is there, so we can be compensated with the next day. Like according to the patient's time, everything we can fix the schedule.
So, doctor, as Matra Vasti is given daily, can be Nirva Vasti also given daily?
Yeah, doctor. Nirvasti can be given daily, but in certain conditions, like we are using Yapana Vastis or Ardhamatrika Vastis, like Paitarana Vastis, can be given daily. This is also quoted in the same Sushrita Samhita, Chikitsasthana, where in Ardhamatra or Ardhahina Matra, that is 900 Navaprasritika, which is coming in Madhutailika Vastis and Yapana Vastis, can be performed continuously. And Anuvasana Vasti, as we all know, it can be performed continuously.
So, doctor, let's talk about the effect of the Basti. So, what do you think? What is the effect of Basti on gut-brain axis?
Yes, doctor. Right now, recent researches have been there in gut-brain axis, and various researchers saying like gut microbiome plays an important and role and influencing our mental health. And this has been again said like millions of neurons are passing around the intestines, which we termed as enteric nervous system, which is very similar to our CNS, cranial nervous system. Thereby, it's connecting by our neuron pathways, and this has been told prior years by our acharyas, where you can see the effect of Basti, like Samyak Basti Lakshanas, which are the effects when it is given appropriate. We can see this Raktadi Buddhi Indriya Mana Prasadam, like where prasadhanam to our Buddhi, Indriyas, and improving the sleep effect. All these has been, we can correlate with like, okay, acharyas are also having the same idea of reaching till the brain. Like there is a simile where Basti has been said like when Basti is introduced, it will give all the effect throughout the body. Like the simile is when the sun is rising, the rays of the sun spread all over the earth. Similarly, Basti also, the video of Basti also spreads all over the body. So this simile is highlighting that Basti Karma influencing all over the body, especially this mind health, like which is very similar approach in recent researches as gut-brain axis.
So, yes, doctor, these are the very proud moment when we hear these kind of researches are being done and these kind of results we are getting from them. So, doctor, let's talk about the Basti procedure. What are the points to be considered before planning a Basti procedure?
Yes. In this only the Samiksha Bhava's importance are taking place, where all these factors should be considered not only for Basti Karma but also for Vamanam, Virejanam, all other karmas. These Samiksha Bhavas to be considered. Those are Dosha, Desha, Ushida, Kala, Sattva, Satmya, Ahara, Bala, etc. And I can say quote some few examples for more better understanding. And regarding Vasti itself, like if the Bala or Bala is less, if we use a Sukumara person, we can go for like Ardhamatrika Vastis, like they're very less dosage. And if the disease is very acute onset or like not that much chronic, we can plan for Yoga Vasti. If it is that chronic and that severe, we can plan for a Karma Vastis or Kala Vastis, like that for fixing the schedules, number of Vastis to be given, and how much dosage should be given, and by selecting the Dravyas, like Mridu, Madhyama, Tikshna, Aushadha Dravyas, to select all these Samiksha Bhavas to be considered.
Very nice, doctor. So, doctor, now I want to know about your research work. You have done your research in Gridhrasi, the effect of Basti in Gridhrasi. Yes, please tell me about something about it.
Yes. Yeah, doctor. My research work is on Karaskara Grita Matravasti for 9 days, particularly in the management of Pachaja Gridhrasi. I have chosen this Gridhrasi disease in my thesis because I have personally experienced Gridhrasi pain. Actually, that is very like hell. So I want to put some outcomes in this disease particularly. And since I am having a background of yoga, I have seen many persons who's practicing yoga, like at one point of time they're having experiencing this Gridhrasi pain. So I can give some outcomes to the community of yoga also. So I have taken this Gridhrasi out of my interest. And when coming to the procedure, I have selected Matra Vasti. Gridhrasi being Vata Nanatmaja Vikara and Basti Karmas being one of the Chikitsa Sutra. I have selected Matra Vasti because of convenient OPD day practices, and also in this modern era, like Matravasti won't spend that much time or observations needed currently, saving the time. So I have selected this Matravasti, and this has been done given for around 9 days. The number of days also having its own relevance, because ninth day of Basti reaches the Majja Dhatu as quoted by Sushrita and Vangasena. I have selected this ninth day, and I just really want to know whether this ninth day is reaching the Majja, because Gridhrasi, like correlating with sciatica, their common causes intervertebral disc prolapse, where considering disc as a Majja, like presenting in between the asthis, I consider that as a Majja, and seeing in any structural changes there before and after Vasti. So I have taken MRI as my investigation criteria, where I am taking on the first day, like 0th day, and I am taking on the 10th day, and seeing whether within 9 days can we see some structural changes in MRI too. And selecting a drug is like another big challenge for me. And I have selected here is Karaskara where Kupilu is being the primary drug, that is Strychnis nux vomica, which is a toxic Upavisha drug. But after doing proper Shodhanam, the site of action is on the nerve. And researchers have been proved that this Kupilu, Strychnis nux vomica, after proper purification, is having its regenerating capacity of the nerve, particularly in peripheral nerve. Sciatic nerve is being considered as the peripheral nerve. I have chosen this Karaskara for Basti Karma. And the results are also like equally and the results are having good significant improvement, where all the symptomatic reliefs and recovering to daily activities beyond the pain is also have been seen around 40%. And I have seen results like significant improvement I have seen in both subjective and objective parameters, where symptomatic relief also have been seen significantly on all over the patient. And even in structural changes also noticed around 50%. Like I have noticed around 50% relief in ligamentum flavum hypertrophy, and also all the disc space have been improved, but not significantly. Particularly the disc bulge cases, I can see more good results than the protrusion cases. So Matravasti for 9 days can give some amount of outcomes in acute cases of Gridhrasi, like sciatica, being practiced in OPD practices too. Some kind of outcome we can give in our OPD level itself.
So, doctor, so you have been invited for your research work in Jodhpur. So, tell me a glimpse about your workshop there.
Yes. As my research work has been selected by CCRAS under PG staff program under the guidance of Dr. Chittaranjan Das sir, we have been invited for a 6 days workshop in IIT Jodhpur on the topic precision health. And there we have noticed like a separate department named as Ayurvedic has been working and doing like advanced researches in Ayurveda, where 6 days classes based on genomics, metagenomics, structural biology, sensors, inflammation, molecular biology, nanotechnology have been explored short glimpse, and what are all the researches advancedly they are doing there that has been exposed to us. And we are very impressed to see, like because one of my friend from Prasuti department also selected for this program. So we both has been explored like, wow, this much advanced researches have been going on in Ayurveda, and there has been they are just standardizing the prakriti, like examination by using the sensors and by walking and by speaking, the voice, everything they are just decoding and making for suitable examinations or a screening tool to examine the Prakriti, and many works have been going on there. And I feel this is a great opportunity where all the allopathy people who's having good research background has been turning to Ayurveda to for its legacy, like for its asset. This is the right opportunity for us to stand for our Ayurveda and to conduct more advanced researches and prove this world like Ayurveda can live throughout this era, like in the past, in the present, and also in the future, rather than all other medicines.
So, doctor, we are going to end this session. Before ending this wonderful session, a very knowledgeable session, I would like to request you to tell about your availability, where you can, if anyone from our audience want to contact you, know more about Basti, your research work, or any other doubt they have, they want to know about you or know from you, how they will contact you? Please guide.
Since I have been studying in Chennai for this 3 to 6 months, after 6 months I have been back to my native place Pondicherry, where for further consultation and doubts you can come to my a small clinic setup and Pond Yoga Center. So by using Google Map you can tag this Pond Yoga Center and you can directly come for my consultations. And if at all you are unable to reach that, you can reach me through my mail ID. My mail ID have been displaying under the screen, so you can contact me at any time using mail ID.
So, ma'am, now we are going to finish our wonderful session. I will say very knowledgeable session it was. So, thank you for coming. If you want to say anything, all podium is yours.
Okay, thank you, Dr. Udit Saxena. Personally, this podcast have a special connection with me, being the first podcast of myself. So, friends who are all in needy of knowing the knowledge of Ayurveda, or whom you feel like you have to share, please share this video and please share this video as much as possible and subscribe this channel for knowing further good and valuable podcast. And I will be continuing exploring more Ayurvedic knowledges in this channel. So please subscribe and keep on watching this channel. And thank you, Dr. Udit Saxena, for giving me this wonderful opportunity and inviting me to this consultant podcast on your channel. Thank you.
This was my pleasure, ma'am. Thank you for coming. Thank you for watching, everyone. Thank you.